All right, this case study is Booze Blues, a case on the liver. Peggy Fender is well known to the emergency department staff. She's a 59-year-old woman whose visit today is similar to her frequent visits in the past. She arrives in the afternoon, appearing intoxicated and complaining of abdominal pain, particularly in the right upper quadrant of her abdominal pelvic cavity. Another fender bender, a nearby nurse whispers to Tim, the new physician assistant who is due to examine Mrs. Fender. Tim proceeds with his physical examination. Mrs. Fender appears emaciated with bruising of various ages on her arms, legs, and face. She is jaundiced or yellow-skinned and has the strong smell of alcohol on her breath. Tim palpates the inferior border of her liver, which is hard and enlarged. Mrs. Fender moans with pain. Her entire abdomen is acidic, swollen, and fluid-filled. Mrs. Fender is not entirely coherent. She knows where she is and who she is, but is unable to relate anything about her present illness except a slurred, "My stomach hurts, quit poking it, you idiot." Her coordination is poor when she attempts to sit or stand. She becomes annoyed and indignant when Tim asks her how much alcohol she's had to drink today, even though she is obviously inebriated. Scroll down a little bit. Tim reviews her blood tests, which reveal elevated blood transaminases, which are your liver enzymes, high blood glucose, hyperglycemia, and prolonged prothrombin time, PT, which is a slowed clotting time. Based on her history and present findings, Tim diagnoses Mrs. Fender with alcoholic cirrhosis, which is the result of chronic inflammation of the liver from heavy, consistent alcohol ingestion. If alcohol abuse continues long-term, it leads to fat accumulation in the liver, followed by fibrosis and severe liver dysfunction. All right, before we get to the questions you guys need to answer, I'm just going to point out a few things as we go through here. So, very frequent visits to the emergency room. She's intoxicated in the afternoon. She has abdominal pain in the right upper quadrant, which is where your liver is. The nurses know that she comes intoxicated on a regular basis. Examination stuff, we'll go through all this more in detail, but emaciated, you have to understand that alcoholics very often are malnourished. When you look at, like in nutrition class, and we talk about who's malnourished in the United States, it's usually, pregnant women and alcoholics that have to be the most concerned, or else elderly with digestive problems. So emaciated, bruising all over her body, jaundiced, we'll talk about what that is, alcohol on her breath. So normally you can barely palpate the liver when you go up underneath the right side of the rib cage, but her liver is hard, enlarged, and it's painful to palpate. So those are all signs of problems with the liver. We'll go into deep detail about ascites and why her abdomen would be swollen and fluid-filled. She's having what we got: balance problems, slurred speeches. She's not entirely coherent. Those are, like when they're testing you, if you're driving and they want to give you a field sobriety test, what they're actually looking for is signs of cerebellar ataxia. So when you're drunk, your cerebellum can't properly do its job, which is balance, posture, and coordination. So those are all signs that are here. And as we'll see later, chronic alcohol use can cause central nervous system problems that are permanent as well. What else? Elevated liver enzymes, of course. Anything putting stress on your liver would cause your liver enzymes to go up. That could even be using ibuprofen or lots of drugs, taking antibiotics to treat tuberculosis, etc. High blood sugar, we'll talk about why that is, and then the slowed clotting time, which is a very important factor here with her bruising, etc. So we'll look at alcoholic cirrhosis, but just so you know, there are other ways to get fatty liver disease that can lead to things like cirrhosis. You have infections, so hepatitis C can lead to cirrhosis, liver cancer, etc. And now, sadly, we have millions and millions of Americans, nobody knows how many, but really the smallest number I've seen is 40 million Americans that now have non-alcoholic fatty liver disease. It used to be if you had a fatty liver, it was because you were drinking alcohol. It was fatty liver disease, alcoholic fatty liver disease, which then led to liver fibrosis, which then led to cirrhosis. But now many, many Americans have non-alcoholic fatty liver disease. Primary causes of that appears to be the overconsumption of sugar, which is glucose and fructose, and nutrient deficiencies. We need nutrients like choline if we want to keep our liver from accumulating fat. So a diet that's not rich in certain nutrients and a diet that's very rich in sugar can definitely lead to the accumulation of fat. And then so now let's go ahead and look at the questions. That's what I see when I walk through this. This is a pretty clear cut quick case. Sorry, but I enjoy this case study because it shows you just how important the liver is. If you want to know how important an organ is, a tissue is, a gene is, just knock it out, make it so it can't do its job, and see what goes away. That's honestly how they do most genetic studies, etc. Let's go ahead and go through this. Let me scroll down. Question 1. Besides the nurse's Bender comment and Mrs. Fender's social history, Tim suspects alcohol abuse based on many of his physical exam findings. Name at least 3 signs and/or symptoms that point to alcoholism, and briefly explain why each sign or symptom may occur. But real quickly, what is a sign and what is a symptom? A symptom is something subjective that the patient has to tell you. When you're talking about pain and things like that. A sign is an objective thing that can be measured. So lab test, orthopedic test, etc. All right, let's scroll back up then and look for the signs and symptoms that point to alcoholism, because there are quite a few of them. I mean, just first of all, as I'm reading through here, drunk in the afternoon. Not saying everyone that's drunk in the afternoon is an alcoholic, but she's clearly been drunk many times, been drunk enough to need to come to the emergency room many times, so that's a problem. But the fact that it is during the day is an issue. So, drinking during the day is definitely at least a yellow flag, if not a red flag for alcoholism. What else? Let's start with the hepatomegaly. So she has an enlarged liver. So when the doctor is palpating her liver, it is large, it is hard and fibrous, harder than it's supposed to be, and it causes pain. So we know that her liver is swollen for those 3 reasons. So that's called hepatomegaly. So why is that? Well, the liver is actually scarring. That's why the fatty liver disease leads to fibrosis, which is scar formation, and then cirrhosis. Cirrhosis is basically you've turned almost 80%, give or take, of your liver into a scar before you're going to have the actual symptoms of cirrhosis. So fatty liver disease leading to this scarring, leading to cirrhosis. But then her liver is also going to be swollen because we'll talk about things like portal hypertension here in a bit. So her liver is going to be swollen, but also scarred up. So that's why she would have this enlarged liver or hepatomegaly. Another one, let's see, we have the jaundice. So her, the sclera or whites of her eyes, her skin are going to be yellow. You're going to notice that especially on like the palms of the hands, soles of the feet, where there's not as much kind of background color. But then the eyes are usually the best place to see jaundice. That is going to be because since her liver, one of the jobs of the liver is to take, once we break down red blood cells, and we break down 2 or 3 million of them a second, they're turned into heme, and then the iron is released. So part of the breakdown of red blood cells is turning this heme into the compound bilirubin. So bilirubin is supposed to be taken by the liver and released into the bile. So that's actually why bilirubin becomes things like urobilins and stercobilins that actually cause the color of your feces and your urine. So, but if the liver can't do its job, the bilirubin stays in your blood, stays in your tissues, and that's why she would have the jaundice. So we mentioned jaundice, the enlarged liver, the ascites. That, as you'll see reading through these questions, the ascites are going to be a big part of this discussion here. Let me go ahead and pause for just one moment. I heard a noise. All right. Hopefully you guys don't hear this big thunderstorm in the background, but so we were talking about ascites. So I won't go into detail here, but the fact that she has this swollen abdomen is going to be caused by ascites, which actually has multiple potential causes. And I'll give you other examples of when it might occur, like in a child who is starving and dealing with protein malnourishment. So we'll cover ascites in several questions later, so I won't go into detail about that now. What other one? So the bruising. So, but what we've already mentioned once with the slow or prolonged prothrombin time, that she's going to have issues clotting. So not only is her blood not going to clot as well, but chances are, if you've ever been drunk, it's easier to bump into things, fall down, get bruised. So bruising is going to be one as well. Oh, what else? Oh, we did see the high blood sugar. So your liver is an unbelievable organ when it functions, and its job is to take the nutrients that are coming in through your gut and use them and store them and change them however needed? Well, liver glycogen is very important. So your liver can take glucose and turn it into glycogen. And liver glycogen is what keeps you from dying when you're not eating in the middle of the night or if you're on a prolonged fast. So your liver can release that glycogen to keep your blood sugar stable between meals or in the middle of the night. Your muscles also store glycogen, but the difference there is muscle glycogen is only used by those muscles. Liver glycogen is what maintains your blood glucose levels. So she has high blood sugar. I mean, she could also have diabetes. You have to understand that too. But she has high blood sugar levels because her liver can't do one of its many jobs, which is to turn excess glucose into glycogen. What else here? Just a long list of things. I think we've covered most of the important ones here. Well, if you want to cover one more, it is the fact that she's just showing kind of social signs of alcoholism as well. So we talked about drunk in the afternoon, many visits to the emergency room. So clearly her drinking is affecting her life. And then when the doctor Tim asks how much alcohol she's had to drink, she was annoyed and indignant. So think about it. If your drinking is causing you to drink all the time and it's causing you to need to go to the emergency room and clearly damaging your life, and usually people are going to feel guilty about that. She doesn't show any signs of that, but she certainly is annoyed. So when someone gets annoyed, when you ask them questions about potential alcoholism, that can often be a sign that there is some alcoholism. So those would be the best answers for number one. So any sign or symptom related to alcoholism. All right, question 2. The liver is known for its ability to remove certain toxins from the blood. I mean, you think about blood does kind of run through the liver and is filtered out. But we often think of the liver as a filter. So people, like from an organ meat standpoint, some people don't like to eat liver because they think it's kind of like eating a dirty sponge. You're eating this organ that's a filter, right? But the liver is actually a biochemical filter. The liver filters things out of your blood by changing them so they can be excreted in your urine, or changing them so they can be excreted in your bile, or changing them so they can be stored in your fat. So if you're worried about consuming liver, just as an aside here, because I'm a huge fan of organ meats, if you're concerned about eating liver because thinking of it storing all these toxins, that's not the case. Matter of fact, if you're eating animal products and you're worried about eating the toxins, it's the blood. Not the blood, sorry, it's the fat. I was reading the word blood there on the screen. Because if a toxin can't be excreted in your urine and can't be excreted through bile, it will be stored. Your body actually hides toxins in your fat so that they're not affecting your metabolism as much as they would be in your blood. So, again, not saying this is a big issue, but certainly if you're going to eat animal products, you should eat clean animal products. And one of the benefits of eating organic is that the animals that you're consuming haven't been exposed to as many toxins, so their fat should have less toxins in it. So just kind of an aside, but yes, the liver is a filter, but it's a biochemical filter, not a physical one. Don't think of it like your coffee filter or a dirty sponge. Okay, it can perform this function because its cells, which are called hepatocytes, contain large amounts of lysosomes and peroxisomes and also have an extensive, smooth endoplasmic reticulum. So briefly describe how these three organelles contribute to this major function of the liver. All right, so going back to learning the cell organelles, the lysosomes, we would have called them the digestive systems of the cell. They're basically a bag full of acids and enzymes that can break down things. Peroxisomes are somewhat similar, but they play a really important role in neutralizing free radicals and dealing with fat-based or lipid-based substances, but they also play a major role with alcohol here. And the smooth endoplasmic reticulum, we would have said it plays a role in producing, fats and sugars, but also inactivating toxins or detoxifying. So let's go a little bit more into detail there. So lysosomes, they really are just this bag of acid that can break down toxins and get them and turn them into a form where they can be eliminated from your cells and hopefully from your body. Peroxisomes, their main function is they're going to have oxidases, and oxidases will allow them to neutralize alcohol or detoxify alcohol. And actually, it does become slightly more toxic before it becomes less toxic, but that's neither here nor there now. So these oxidases are going to allow these peroxisomes to break alcohol down. But as the oxidase enzymes work, they actually produce hydrogen peroxide. So there's also going to be catalases in your peroxisomes that will neutralize those. In microbiology, we do catalase testing on bacteria where we actually see what happens when we expose them to hydrogen peroxide. If the bacteria has the enzyme catalase, you'll see it bubble. So your cells have catalases, which is why if you put hydrogen peroxide on your skin, you'll see that bubbling. That effervescence is the technical term, I guess. Then your smooth ER, it is, your rough ER modifies proteins and packages them for transport, etc. But the smooth ER its primary job in this sense is going to be that it has enzymes that are very important for detoxification. So this also would be where the idea of a tolerance would come from, whether it's alcohol, pain medication, really almost anything. The liver cells will change. If you were to drink 6 Keystone Lights or whatever college kids drink these days, every day, that 6 beers would affect you way more on day one than it would 6 months from now if you were doing that. And that's everyone knows what a tolerance is, whether you build a tolerance to your prescription drugs or alcohol or anything else. You will actually see histological or tissue and cytological cell level changes in the liver. So if someone has built up a tolerance to alcohol and you looked at their hepatocytes, their liver cells, you would see more smooth endoplasmic reticulum. You would see more peroxisomes and you would see more lysosomes. I would say the peroxisomes and smooth ER are the most important ones here. So you could actually see that, or you might even be able to take cell samples and guesstimate at least how much alcohol somebody could consume before they got intoxicated, because there are certainly genetic differences. People like me who have Irish descent and people with Scottish descent are going to be able to tolerate alcohol on the average much more than people of Asian descent or Native American descent. So that's just our genes. But then, and just like anyone with exercise can increase their VO2 max and how they use oxygen and become more physically fit, I guess anybody could develop a tolerance to alcohol. So let's not shoot for that goal, though. All right, that's question 2. So that's why the hepatocytes look different than other cells. At least these cells, their primary job is detoxification, and that's why you have these structures. All right, question 3. Another drink here. Gotta stay hydrated, everybody. All right, number 3. Mrs. Fender's jaundice is caused by the accumulation of bilirubin in her blood and tissues. What is the normal fate of bilirubin, and what role does the liver play? Explain how Mrs. Fender's cirrhosis is related to her jaundice. All right, so remember, every second, 2 to 3 million red blood cells are broken down. Basically, the iron is going to be saved, and the rest of the cell becomes this heme, this product that's going to be recycled. Iron being saved, that's why there's lots of iron in your liver and lots of iron in your spleen. That's why the spleen is red, and to some extent the same thing with the liver, because it's where the iron that's taken from these recycled red blood cells is stored. But the heme portion of these recycled red blood cells is turned into bilirubin, and the liver's job is to get bilirubin into your bile and then into your gut, and then there it's going. We already mentioned how from it creates urobilins, which will actually color your urine, and circobilins, which will color your stool. So instead of having yellow skin, you're supposed to have yellow pee and brown poop, I guess. But if the liver can't do this job, then there's too much bilirubin in the blood and tissues, and that's why you see it. You see the yellowing of the skin, the white of the eyes, the sclera, etc. So how does that relate to her jaundice? I mean, her liver isn't doing its jobs. I mean, the liver has hundreds of jobs to do at any time, and her liver isn't doing any of its jobs well. But one of the jobs it isn't doing is getting rid of bilirubin. Next question, number 4. Mrs. Fender's prolonged clotting time, that was that prothrombin test or PT test, and excessive bruising are related. Again, referring to normal physiological functioning of the liver. Why do these two things happen when alcohol damages hepatocytes? So before we even get into the physiological function of the liver, let's just talk about, the falling. When we mentioned that when you're intoxicated, anyone that's been intoxicated knows that, balance, posture, coordination are going to be affected. This is why there's a legal limit for alcohol if you're going to be driving a vehicle, because your reaction time is going to be slowed, your coordination is going to be affected. So excessive bruising could come even before you see a lot of liver damage. She could be waking up with bruises just because she fell down and those kind of things. But what we're actually looking at here is that, again, her liver is cirrhotic, which means that 80% of it isn't doing anything. So she's literally barely surviving. So why would she have the prolonged clotting time and excessive bruising? Well, those two things are clearly related. But so her blood vessels are going to be damaged more easily. But the main thing here is what the liver needs to do. So the liver actually is going to produce the proteins that are needed, the clotting proteins that are needed. And without them, your blood can't clot. We won't go into the intrinsic and extrinsic and common blood clotting cascade pathways here. But again, one of the many things the liver is supposed to do is to produce your clotting proteins. Now, these clotting proteins also need things like vitamin K and calcium. So the fact that she's malnourished could certainly be playing a role here too. So let's say her damaged liver isn't producing enough of the clotting proteins. And then she has gut problems and a poor diet because of her alcoholism, so she doesn't have enough calcium or vitamin K as well. All of those things, she's probably not having too many salads with her Hawkeye vodka. So all these things could be affecting her ability to clot blood, but the actual liver's job is to produce the clotting proteins. So she does not have them, and so it's just a recipe for disaster. Your blood, you have a prolonged clotting time. Your blood doesn't clot properly, and you're falling around and bumping into stuff. So that's why she's going to have the bruising, and then that prolonged PT or prothrombin clotting time test. Number 5. The liver has a portal vein as well as a hepatic artery. It also has unique exchange blood vessels similar to capillaries called sinusoids. How do these unique structures determine the function of the organ? So before I answer the question, let's just look into a little bit here. First of all, I would have taught you that sinusoids are a type of capillary. So different resources would say differently. You have the regular continuous capillaries that have the tightest junctions and only allow small things through. You have fenestrated capillaries. Fenestra means window, so they're going to have larger openings that let medium-sized things through. And then sinusoids, I actually teach, are a type of capillary, but they do have gaps, so they allow larger things through. So don't let that confuse you, but some sources would say that they're like capillaries and they are an exchange blood vessel system, but they're not technically a capillary. So that's not the point here. The other just basic thing I teach about sinusoids is because they have these large gaps, remember that sinusoids are going to be lined with macrophages, because larger structures can get through sinusoids, even in a healthy liver or wherever else you're going to find them. Your immune system is keeping a real close eye on them. Every continuous capillary and fenestrated capillary is not lined with macrophages, which, clearly immune cells, big eaters they are, but sinusoids are. All right, so let's look at a few things here. The liver has really the coolest circulatory system of any organ, if you ask me, just because it seems so backwards. About 3/4 of the blood that's coming to the liver is actually going through the portal vein. If you think about most organs, arteries are carrying blood to the organs and veins are carrying them back. But in this case, it is 75% of the blood that's reaching the liver is coming from the vein. Remember, what is the definition of a vein? It's a blood vessel carrying blood back to the heart. So the portal vein is running through the liver, and it's very important, but it's carrying blood back to the heart from your intestines. So that's why your liver has all this venous blood coming to it, because it's calling dibs on everything absorbed from your gut. So your stomach, your small intestine, some of your large intestine, your pancreas, all these things, that when things are going to be absorbed from the gut, they're going to go right to the liver. And that's true for carbohydrates. It's true for proteins. So if you're eating carbohydrates and your gut has broken it down to glucose, let's say you had spaghetti, it broke the starch down to glucose, and those individual glucoses are going to be absorbed. They're going to go right to the liver. The liver can decide then, should I send this to the cells to be used as glucose? Should I turn it into glycogen? Or if we don't need more glucose in the blood and our glycogen stores are full, I will do a process called de novo lipogenesis and turn it into fat. So the liver will decide what to do with that. Same thing with proteins. When you're absorbing absorbing a bunch of proteins, they're going to head to the liver. The liver is going to need amino acids, the building blocks of proteins, to make its own proteins. It can send those proteins out to do other functions. Or same thing, if you're consuming too many calories and there's just too much protein to use as a building block, your liver says, well, here, I'll turn it into glucose. That's called gluconeogenesis. The liver calls dibs on those things. Now, most fat you consume is actually going to be absorbed into your lymphatic system and then travel through your body to the heart, to the blood, and then get to the liver in a roundabout way. So your liver doesn't call dibs on most fats, but it does call dibs on the short and medium chain fats. Let's say you're eating some fat from butter, which is only like 6% short chain fats, but still there are some there. That's going to go straight to the liver where it can be used as a fuel. But the medium chain ones are really important. A lot of people that are into health and fitness know about medium chain triglycerides or the medium chain fats that you find in coconut oil. But just so you know, if you're interested in that kind of thing, coconut oil is only 15% medium chain triglycerides. You actually would want to buy MCT oil. So I can see my bottle right there. That's because MCT oil, these medium chain triglycerides, they're absorbed differently. Number one, they don't need bile. So if you don't have a gallbladder, they can get into your bloodstream easier than the long chain fats can. Number two, medium chain triglycerides, they're going to go right into your blood, straight to your liver, and they're actually a really, really good fuel source. So most fat, it takes a while after you eat it to turn into fuel, and it burns really slowly. But medium chain triglycerides, they actually, they're right around 8 carbons long. So when you split them in half, they're basically ketones. So medium chain triglycerides can become ketones or ketone bodies very easily. So much so that, studies have shown that if you give like college students 300 grams of pasta and 100 grams of tomato sauce and then some medium chain triglycerides, they will still make some ketones. When most people think of ketones as you're starving or you're on a ketogenic diet with no carbohydrates, but medium chain triglycerides will actually become ketones very easily in anyone. So that's just kind of interesting. But so most of the blood going to the liver is actually coming from a vein, and that's because the liver stands between the gut and the rest of your circulation. So that's really what it is. The liver is just calling dibs. The other 25% would be the hepatic artery. I just noticed that the liver has a that's a typo there. You're looking at the liver as a portal vein as well as that should be a hepatic artery. So sorry about that on number 5. I literally just noticed that. But the hepatic artery is going to be carrying blood to the liver to keep the liver healthy. Kind of like your coronary arteries take care of the heart while the heart takes care of the rest of the body. The hepatic artery takes care, not the hepatic vein again, the hepatic artery takes care of the liver while the liver takes care of the rest of your body. So the liver gets a massive amount of blood supply. It's right up there with the brain as far as the largest percent of your cardiac output. Your liver is extremely metabolically active. When we talk about like your, basal metabolic rate, I mean, your liver is a large chunk of that because it is so busy and it's doing so many things. Even when we talk about, like the danger of fever with your elevated core body temperature, really it's the liver primarily that we have to keep at the right temperature. The liver is very, very important. And then back to these, so these sinusoids, what they allow is the blood from the portal vein and the hepatic artery are going to mix together in there, and that's going to allow the liver to pull out what it wants to pull out, detoxify what it wants to detoxify, send away what it wants to send away. So it's just basically blood just kind of flows through your liver, and as it does so, the liver gets to do whatever it wants with it, and then it sends everything else along. So that's the portal vein, why the portal vein is important, why the hepatic artery is important, and why we have these sinusoids. Anywhere you have to move like massive amounts of stuff in a small space, a sinusoid is going to be a really, really important thing. Let me also mention what a portal system is too. So if you're wondering why they call it a portal vein, there's another portal system that you probably have learned about, which would be the portal system of capillaries between the hypothalamus and the pituitary gland, because that's a tiny space and there's going to be tons of hormones and things moving between those two. So they have a portal system as well. So what a portal system is usually it goes artery, arteries getting smaller and smaller, and then an artery becomes an arteriole, which links up to a capillary bed, to a venule and a vein. A portal system would be artery, arteriole, capillary bed, another capillary bed, venule, vein. So you see between the fact that there's multiple capillary beds there and we have these large gaps in these sinusoids, you can see that this system is designed to move tons of material as quickly as possible. All right, that's number 5. Number 6, which really both 6 and 7 both kind of tie together. Cirrhosis leads to scarring and increased hydrostatic pressure in the hepatic portal vein. Explain why this increased venous pressure causes net filtration to increase in the hepatic capillaries, leading to ascites, which is swollen and fluid-filled interstitial space of the abdomen. All right. So it already says there that you're seeing scarring. The portal vein is going to be scarred, and that's going to cause an increase in the blood pressure in the area. That's known as portal hypertension. That's something clinically you'll hear a lot. So the hydrostatic pressure, the blood pressure in this system is going to be elevated. And if you remember anything about how fluid is filtered out of capillaries and then reabsorbed, it is capillary hydrostatic pressure that pushes out fluid. So give or take, 24 liters of fluid a day, and the average healthy person is going to be pushed out by normal capillary hydrostatic pressure. And then on the flip side, which we'll see in question 7, osmosis. So pressure, hydrostatic pressure pushes fluid out of our capillaries. Osmosis sucks it back in. So 20.4 liters should normally be sucked back in. That difference, the 3.6 liters, would be what becomes, what is your interstitial fluid, the fluid between your cells, and then becomes lymph. And that's how it's carried back to your circulatory system through your lymphatic vessels. So a normal healthy person is going to be filtering out 24 liters of fluid a day and reabsorbing 20.4. So increased hydrostatic pressure in this portal hypertension means I can't give you a number. It's going to depend on the person. Maybe this increased pressure is going to lead to them filtering out 26 or 27 liters of fluid a day. And then as we'll see in the next question, there won't be enough osmotic pressure to suck back in the 20.4 liters a day. So a normal healthy person is going to have 3.6 liters of fluid a day that's not accounted for, that bathes our cells with nutrients and oxygen, and then becomes lymph and is carried back. Well, that number can get much higher. You see people with like end-stage liver failure, end-stage liver cancer that are having, 15 or more liters of fluid removed off their abdomen every week. So that's a major problem. So let me make sure I answer this question because it is tied right into question 7. But so increased, support. So basically there's 2 sides of this equation. This side's going to be increased. You're going to have more filtration because you have more what's known as capillary hydrostatic pressure, and that's caused by those portal veins being so scarred up that the blood pressure in them is through the roof. All right, question 7, last question here. Explain why the underproduction of albumin by a cirrhotic liver contributes to excessive filtration, which leads to ascites. Refer again to the forces that determine net filtration pressure in the hepatic capillaries and to the function of albumins. So just a quick review. Albumins are the most numerous, most common plasma protein made by the liver. So your liver your plasma proteins are going to be your albumins, your globulins, and then fibrinogen, which becomes fibrin when your blood clots. So albumins, they play a major role in osmosis, as we'll cover here, but they also are a transport protein. So this is just not having enough albumin would not just affect this, but this is a major part of it. So we just mentioned a normal healthy person should be filtering out because of the pressure coming into a capillary 24 liters a day. Well, let's say even that happened. This person will not have enough albumin to reabsorb to suck back in 20.4 liters a day. So maybe we have portal hypertension. Let's say there's 26 liters of fluid that's being filtered out, and let's say that 19 is being reabsorbed because there's not enough albumin. So now you're looking at, instead of that difference of 3.6 we talked about earlier, that's what, 7.5. So all of a sudden we got 4 extra liters of fluid in our abdomen to deal with every day. So albumin is a very, very key player in that reabsorption side of things. On the venous side of a capillary, albumin should be sucking back in these fluids. It's actually, if you want to use the technical terms, it's blood colloid osmotic pressure, but really osmosis is water follows solutes, and albumin is a very important solute. So if you don't have a lot of the solute, then water's not going to be sucked back into your capillary beds. So that's why. So question 6 shows why you're overproducing fluid, interstitial fluid, or filtrate, fluid leaving your capillaries, Question 7 says why you're sucking back in or reabsorbing less than you should. So you put those two things together, and that's why you have ascites. So someone would look like they have a pot belly, but it's fluid, not fat. Another case you would see this, there are two types of malnourished children, sadly, when you look at the developing world. And I mean, it's unacceptable that, 19, 21, 27,000 kids die every day because of malnutrition and water issues, depending on who you ask. But there's two kinds of starving kids. There's really, really skinny kids, and there's really, really skinny kids with pot bellies. So the really, really skinny kid is very malnourished and starving, but they must still have some protein. I mean, it could be they're clearly eating their body's proteins and things like that, but the really skinny kid with the pot belly is worse off because they're so low on, they're malnourished clearly, but they're so low on protein that they can't actually they don't have enough protein to make albumin. So their liver might be fine, but they can't actually make albumin. So Peggy Fender here, her damaged liver can't make albumin even if she was eating a ton of protein. That poor kid in a developing country, the liver would be able to make albumin. There's not enough amino acids to go around to do it. Okay, so let's just scroll back up to the top. I think we've hit this one pretty good. So that's why Peggy Fender is in deep trouble. So her alcoholism, and I'm sure her poor diet probably didn't help things, but so there are lots of other factors here too. But her alcoholism has gone from causing a swollen, inflamed liver to a fatty liver to a fibrous liver, so a liver that's basically a scar. And then once 80% of her liver is a scar, she now has such severe liver dysfunction that she has cirrhosis. So don't get that.